I think it's basically reviewing any research proposals that are coming through, being not lab-based, making sure that a future for clinical translation is important, which occasionally scientists lose track of, and then helping, if possible, to disseminate information from the SAC to the general brain cancer population. And my role on the SAC is voluntary and done as an extracurricular activity between my major role, which is running a medical oncology department and a clinical trial department and a lab and looking after patients. I saw that when the AIDS epidemic came into the world, it was absolutely devastating, but the offspin from that was the clinical development of the use of molecular biology, which has had an enormous impact on medical therapeutics. And I think potentially at this time that the only benefit we can see from COVID will be the rapid development of cancer vaccines and our understanding of immunology, which I hope will roll out to therapeutic advances in the not too distant future. I think that I've been involved in managing patients with brain cancer for over 30 years, and although things have improved dramatically from when I first started and the prognosis and treatment options were absolutely abysmal, I've seen a lot of developments and a lot of improvement in patients' quality of life, but we still haven't hit the holy grail of improving therapeutics. And I can see a lot of potential as time goes on with all the discoveries that have been made in recent times that we will have a major breakthrough in the not too distant future. Fortunately, COVID didn't really affect us here in Sydney. Patients needing urgent any kind of neurosurgery were prioritised, and radiotherapy and chemotherapy were available. As you can imagine, there's a huge fear factor for the patients who tended to go into complete lockdown, which was not so good for their neurocognitive development, their exercise programs and their mental health. So I think that's affected patients enormously. But as far as having treatment available, we were not really impacted. Gardening and walking on beaches.